as per IRC, International Agency for Research on Cancer. Bladder cancer is the 9th most common cancer type worldwide. In 2022, more than 6 lakh people were diagnosed with bladder cancer worldwide and more than 2.20 lakh people died from the disease. Bladder cancer is one of the most challenging and expensive cancers to diagnose and treat. Its diagnosis relies mainly on cystoscopy, an invasive and expensive procedure. Most bladder cancers are diagnosed at an early stage, when they are highly treatable. However, about 25% of bladder cancers are diagnosed at later stages. Bladder cancer is a common urologic cancer. It is a disease in which cells in the urinary bladder start growing abnormally and uncontrollably. As cancer cells develop, they can form a tumor and with time, might spread to other parts of the body. Almost all bladder cancer are transitional cell carcinomas, urothelial carcinomas, which begins in the cells that line the inside of the bladder. Bladder is a hollow organ in the lower pelvis that stores urine. The bladder is part of the urinary tract, which is made up of kidneys, 2 ureters, 2 and urethra. Urine is liquid waste made by the kidneys and then carried to the bladder through tubes called ureters. While urinating, urine is forced out of the bladder through a tube called the urethra. Types of bladder cancer. There are different types of bladder cancer that begin in the lining of the bladder. The name of each cancer type depends on the type of cells that becomes cancerous. The main 3 types of bladder cancer are urothelial carcinoma, transitional cell carcinoma, about 90% of all bladder cancers. In this type of cancer, abnormal cells spread and it occurs in the urothelial cells that line the inside of the bladder and other layers of the bladder. It includes 2 rare subtypes which are more aggressive, plasmacytoid and micropapillary. Squamous cell carcinoma is associated with chronic irritation, inflammation or infection of the bladder. Over time, these cells may become cancerous. In short, squamous cell carcinoma starts in thin flat cells that line the bladder. It is more likely to be invasive. Adenocarcinoma is a very rare type of bladder cancer. It begins in cells in gland-forming cells, mucus-secreting glands in the bladder. In short, adenocarcinoma starts in a type of cell that produces mucus in the bladder. It is usually invasive. Symptoms. Most common bladder cancer symptoms are linked with urination changes that may include blood in the urine, hematuria, pain or burning sensation during urination, dysuria, weak urine flow, urgency to urinate, even with bladder is not full, frequent urination. Bladder cancer may also cause pain in the lower back on one side or pelvic area, fatigue, swelling in the feet, loss of appetite and unexplained weight loss, feeling the need to urinate many times throughout the night, feeling the need to urinate but not being able to pass urine. Although these symptoms can be caused by other conditions, so need to check with a doctor. Causes. Cells in the bladder develop changes, mutations. These cells multiply rapidly and go on living when healthy cells would die. The abnormal cells form a tumor that can invade and destroy normal body tissue. There is no exact reason that why certain bladder cells mutate and become cancerous cells. There may be different risk factors that may increase chance of developing bladder cancer, including smoking. Smoking cigarettes or pipes may damage the lining of bladder, which can increase your risk of cancer. Age: bladder cancer may increase with the age. It can occur at any age, but most people diagnosed with bladder cancer are older than 55 to 60. Sex: men are more likely to develop bladder cancer than women are. Exposure to certain chemicals: as per studies, people who work with certain chemicals used in textile, leather, rubber, dyes, paint, hairdressing, etc. may increase risk of bladder cancer, including aromatic amines and arsenic in drinking water. Personal or family history of cancer: people having history of bladder cancer are more likely to have bladder cancer. Chronic bladder inflammation: chronic or frequent urinary infections or inflammations, cystitis, may increase the risk of a squamous cell bladder cancer, carcinoma. Exposure to chemotherapy and radiation therapy: some chemotherapy drugs and radiation therapy may increase the risk of bladder cancer. Long-time infection and catheter use: using urinary catheter for long time, having bladder stones, having frequent bladder infection and other urinary tract infections may have increased risk of squamous cell carcinoma of the bladder. To be continued. Thank you for watching my video. For more videos, kindly like, share